In this short video, we'll be looking at the muscles of mastication. When I think of the muscles of mastication, what comes to mind is Lindner's mnemonic, which I refer to as time. And the T is for temporalis. The M is for masseter, temporalis, masseter. And then the I and the I would be for internal, and the E would be for external. But internal and external what? Internal pterygoid. Internal pterygoid and external pterygoid. Okay. Now remember, sometimes internal pterygoid is the medial pterygoid and external pterygoid is the lateral pterygoid, because internal is medial, external is lateral. So we have temporalis, internal pterygoid, masseter, and external pterygoid. Those are the four muscles of mastication. They are controlled by cranial nerve number 5. Cranial nerve number 5, the trigeminal nerve. So here's the T, temporalis, right? That's a large muscle here. We can see all along the temporal bone and then inserting right there on the mandible. And then here's the masseter, also superficial if we look at that. So temporalis and masseter are superficial. Here is the masseter cut. We could see parts of the insertion site still here. So now we have two left. We have the lateral pterygoid and medial pterygoid. Lateral pterygoid we see here. And then the medial pterygoid we see more inferior to it. We see the two portions to it, here and here. Lateral pterygoids and medial pterygoids, remember, if you think back to osteology, we had the medial and lateral pterygoid plates. When we took the skull and we turned it underneath, looking down at the hard palate, there was the medial and lateral pterygoid processes or pterygoid plates. That's where these pterygoids attach to. And when we chew, the jaw just doesn't elevate and depress, right? It just doesn't go up and down, but it can go side to side. It can laterally deviate. And that side to side deviation is controlled by the lateral and medial pterygoids together. So you can grind your vegetables and chew your meat and your steaks and your chicken and grind everything down. It's not just up and down when we chew. When I treat my patients for TMJ dysfunction or temporomandibular joint dysfunction, I typically have to insert my finger following inside the oral cavity. I follow my finger straight to the back here near their cheek, and I have to press deep into the back on that corner of the cheek. It typically brings my patients to tears. That's how uncomfortable it is. But when this muscle is in spasm, it creates a lot of discomfort to the TMJ, and you get that clicking noise. So I have to release the muscle first and then make an adjustment to the jaw to really bring relief to the patients, and it helps tremendously. So there's the medial and lateral pterygoid. Again, remember, they are controlled by cranial nerve number 5, which is the trigeminal